Welcome to Dr. Downey's Sleep Inc., another clip here on sleep disorders. I don't know if you know this, most people don't, but there's about 100 sleep disorders that exist. And most people think of insomnia and sleep apnea, maybe narcolepsy, and they don't think that there are 100 sleep disorders. I call this sleep disorders by the book, and what I've done here is created a graphical representation of the sleep disorders as I think about them. I'm going to do a clip on each one of these, and hopefully the series will help you understand more about sleep and sleep disorders. One that we've done some clips on is insomnia. There are different kinds of insomnias, and I'll briefly touch on those now. One is circadian rhythm related insomnias, things like jet lag, things like you go to bed earlier than your body's ready for, so we call that advanced sleep phase insomnia. Sometimes it takes you longer to go to sleep than you wish, and we call that delayed sleep phase insomnia. The point isn't the names of these things. The point is that you understand that there are a lot of different kinds of sleep disorders, and each carries its own treatment, so it's important to understand that. Psychophysiological insomnia, there's something called sleep state misperception disorder, a very interesting sleep disorder that we'll talk about. Hypersomnia, meaning that it takes you, or that you're very sleepy. That's what hypersomnia means. Included in this is things like narcolepsy, something that we usually think of as a sleep disorder associated with sleepiness. We'll talk about that. It's very interesting. Breathing disorders such as sleep apnea. There are different kinds of breathing disorders. Obstructive apnea, central sleep apnea, and we'll talk about those. Movement disorders during sleep, things that go bump in the night, things like restless leg syndrome. We'll talk about that. Periodic limb movements, things like kicking during the night, systematically, just over and over and over, kicking through the night. There are things called parasomnias, such as bedwetting, sleep-related eating disorders, REM sleep behavior disorder, where people get up and act out their dreams. And then there's things like sleepwalking, sleep talking, and then, of course, nightmares and night terrors. We'll talk about each one of these and how they differ from one another and the treatment. And then other things such as psychiatric conditions, mood disorders, anxiety, somatoform disorders, psychosis, personality disorders. These are all interesting topics in and of themselves associated with sleep. And of course, if you've ever had pain, you have problems sleeping, things like medication can induce sleep disorders, and substance abuse, things like alcoholism, use of cocaine, and so forth. Those cause sleep disorders. So there are about 100 sleep disorders. So sleep disorders by the book. What we're going to do is have segments on each one of these, hopefully have some interviews. And if you want more information on each one of these, go to our Facebook page, Dr. Downey Sleep Inc., or our Twitter account at Dr. Downey Sleep. Thanks for tuning in to this broadcast.